Hi guys, so this video is going to be about how I study. It was requested and so I'm gonna do it for you guys. How I study depends on the class. Some classes are easier for me than others, and so some things I do for my more difficult classes I don't find necessary for my other ones. I'm going to tell you what I do for each class, and hopefully it helps if you're currently in the program or if you're applying, so you have some ideas for when you are in the program. So to me, my easier classes are prevention and seminar, and seminar is like our lecture portion of clinic. So to me, those two classes are the ones I do the least amount of studying for, which sounds bad, but it's just the truth. What I do first, no matter what class it is I read through the lectures. So I'll literally just take my iPad, I download all my lectures onto my iPad, and then I just read through them, and sometimes I'll talk out loud. So if I'm at a part that I feel like I just need to say it over and over for it to stick with me, I will, and I'll just sit here and talk out loud to myself. I think hearing it helps me. I know there are different kind of learners, like auditory, kinetic learners, I think is what you call it when you're hands-on, and visual learners. I don't really know if I fit into a box. I feel like I like a mix of all of them together, and that really helps me. I think what works best for me is just using a combination of study methods, and so that's what I do. So that's the first thing I do, is read through my lectures and speak out loud. And then I don't always make a Quizlet, but often I do make a Quizlet. So I will make a Quizlet of terms, generally how you would think of flashcards is terms, but I make sure I always, then after I put all the terms, I then put questions in there as well, which really gets your mind in an exam taking mode. I will look at a slide and I'll see what the main information is, and so then I'll be what is the thing that does this, or something like that. So then I get some kind of question out of it, because that's what your test is gonna be like. And then for these two classes, so both of these classes, prevention and seminar, are taught by the same instructor, and she gives us study guides, and they're pretty helpful. Just like any other study guide for any of my other classes, they're not it's not oh, this is all the information I'm gonna ask you about. They can ask you anything from any lecture, but it's just here are the main things that I think you should focus on. So I always do her study guides. I'll fill out the whole study guide, and then I'll really read it out loud to myself until I feel like I understand everything. And sometimes I like doing that more than even a Quizlet. So this is what the study guide looks like. And so I just fill it out on here, and then when I don't have room, I will say what number it is and write it at the bottom, and I will add pictures. I try to fill them out as thoroughly as I can, and sometimes I prefer just doing this over a Quizlet, just looking at it, reading it, and really understanding it. To me, sometimes that's better than a Quizlet, but most of the time I do both. And then also just read through the lectures just so I know that I've seen everything, because like I said, these study guides are everything that you have to know. So yeah, that's really all I do for my easier classes, is I read through the lectures, I thoroughly fill out my study guides and really know them well, and then a Quizlet that includes questions. So that's what I do for my ones that are easier. So then my other three classes that I'm taking, which is head and neck anatomy, histology and embryology, dental anatomy, and pharmacology. These are the ones I consider to be more challenging, and so these ones all have additional things on top of what I do for my easier classes. What those other methods are depends on the class for these three, because they're all very different, and how I feel like you would study for them are very different. For dental anatomy, I use the textbook a lot, and this is probably the only class. That's not true. I do use my textbook to find information sometimes for my study guides for prevention and seminar, but then like I don't really use it after that. But for dental anatomy, our dental anatomy textbook is like a core part of how I study for it. Honestly, for this one, I don't even really read through some of her lectures very much. Like, I'll always look at them, but she gets pretty much all of her information for her lectures straight from the textbook, and the lectures are like really dense. Like, I don't know how to explain it. They're very wordy, and I don't know. Like, to me, I look at them and they stress me out, and I know all of her information comes from the book. So I use the book a lot. It's got a lot of tables that tell you differences between different teeth that help you compare and contrast them, I guess, because you have to know just by looking at a tooth like what tooth it is. And so there'll be tables. It'll be like, how can you tell the difference between mandibular and maxillary teeth? How can you tell the difference between left and right? Like, how you tell the difference between a first molar and a second molar? Like, it just really breaks it down for you well. Like, I really like using the textbook over just looking through her lectures for that kind of stuff. For other things like occlusion and other concepts that we learn in class, her lectures are fine, but just learning, I guess, in the earlier part of the class, like really the anatomy of the teeth, I prefer using the textbook, and also our teeth models. You take them out, and they're stuck on here on wax, so you can like remove them and put them back on, but this is what they look like. And so I will use this with the textbook. So the textbook, like I said, is telling you the difference between the teeth and how to know, you know, because sometimes it's hard to tell, like, okay, I can look at a tooth and be like, that's an incisor on the mandible, but then sometimes it's hard to tell between like the right and the left or whatever. So it'll really explain that to you well, and then you just practice. Like, I'll take two teeth out that I think look similar, like 24 and 25 to me, and most people look pretty freaking similar. So I'll take them out and look at them. 24 and 25 are your mandibular central incisors, so your bottom front teeth, I guess. And if you see, I don't know if it's like showing up well. They look very similar. So when we do our ID exams, one will just be on the table, and then you have to say, okay, this is number 24, that's your permanent mandibular left central incisor, is what you'd have to say. And then sometimes there are like, there's a marking on them in like red, like say this little bump right here on one of our exams was like circled, and you'd be like, okay, that's a cingulum. So those are the kind of things you'd study for like your identification exams in dental anatomy, and these are the tools that you would use to study. I'm pretty sure every program gets these teeth. So once on my own, I compare and contrast the teeth and really study them myself. Then I would have my husband just hand me a tooth, and I would tell him what it was. So he'd hand me a tooth, and it'd be like, okay, that's tooth number 3, that's your permanent maxillary right first molar. And yeah, that's how I would do it until I got all of them right. And don't just study until you get it right, do it until you can't get it wrong. So yeah, if I got one wrong, I would keep going through them until like I was getting it right consistently, and then I would feel pretty good about it. And then these are always in my backpack. So at school, on my lunch, like before this class, I would practice them again with my friend Bree in the class. We would just like take turns giving a tooth to each other. Like even at the same time, we both give each other a tooth from our own set, and we would be like, okay, this is tooth number whatever, and then yeah, I've got it right, move on. And that's just what we would do like before the test, just to make sure that we really know our stuff. So yeah, that is dental anatomy. That class, it's hard because there's a lot of details to teeth, more than you would ever know, but it's doable. All these classes are doable, it just takes hard work. So now we're gonna move on to head and neck anatomy. This class I think is really interesting, but it's hard. A lot of people struggle with this class. It's just a lot of information. If you've taken an anatomy class for like your prereq, it's like that, but more specific because it's just your head and neck. So it's very in detail, but you can do it, I promise. So for this class, sometimes I make a Quizlet for this class. Often I don't. Yeah. So she gives us study guides. Like I said before, it doesn't mean everything you have to know is on them, but she makes pretty good study guides that have pretty much all of the major concepts on there. And so like for my other classes, I will fill those out on here and really read through them, talk out loud, and make sure that I really am understanding them. They're not cheap, but I promise you it's the best study tool is my iPad. Like literally the best. So I'm going to show you how I like fill out my study guides really quickly. And this is how I fill them out. This is a head and neck study guide, and that's a dental anatomy lecture, but you can split screen within the app Notability, which is what I use and highly recommend. So I just go through the lecture and fill out the questions over here. You can make one side bigger than the other, zoom in, you can search, like Command F if you will, on here. So you got this little search tab and search, and then you type in what you're looking for if you can't find it. So yeah, it makes it really easy to find what you're looking for. It even like when you're searching like that, it even picks up your own handwriting. So if I type in like molar, anything on that slide, and you can even do it just generally on your notes. Like you can come out of your that one slide that I was on. Like this, for example, is all of my notes on my iPad, and there's a search bar at the top, and I can search something like enamel, and it will show me all the lectures that have the word enamel in them, and then you select the lecture, and then within the lecture it tells you all the places that have the word enamel. So it's great. Like my notes, a regular notebook couldn't do that for me. A textbook, I guess, has an index, but like it just is faster and really efficient, and it's fabulous. All I have to say, this is not sponsored by Apple, but it should be. That's all I'm saying. So yeah, I really do those study guides for head and neck. I will talk them out a lot. Like they're all the different, you know, phases for how to this form. Sit there and talk it out. I think I also did make a study or a Quizlet, but I don't use Quizlet as my core way of learning the material. It's more of just a way for me to like test myself, but I really just like to read through and talk out loud. That's just, for me, the best method. And then for like the lab side of head and neck, so like if you take anatomy, like general anatomy, it's the same where you have to like identify the anatomy of things. So like the bones of like the skull and the muscles and like the vessels, like the arteries and the veins and the nerves and all that stuff. Like for bones, there was like skulls out, and she would like have a little pin in something, and you'd have to say like what the bone was, like what structure it is, all those things. And same for the muscles and all the other things. So how I like to learn those structures is using an app called Anki, which is like a lesser known app that's similar to Quizlet, but it's better for pictures. I know you can do pictures on Quizlet, but I'm pretty sure you have to have like the premium Quizlet, which costs money. This is completely free. I really recommend it, and I kind of like their algorithm better than with Quizlet. So with Quizlet, like if you're going through flashcards, like you just go through flashcards like you normally do. Like you do one and then you move on and you go through a whole deck. If you're doing the flashcards method, there's also like the learn method, which is nice, but like I'm just talking about regular flashcards. So like you just go through the whole deck, and then if you want to go through them again, you go through them again. But with Anki, they give you like a little set of a time. So like they'll give you maybe 6, I'm making that up, like a small number. It'll be like 6 different structures, like the pictures that I showed. And I'll show you how I do that in a second. And then it'll have that feature, and I'm like, okay, that is the occipital bone or whatever. And then I'll flip it over, and then it'll give me like the answer, and then it'll say fail, hard, good, or easy, I think. And so like if you knew it, like I looked at it and I said occipital bone with ease without even thinking about it, then I'd say that was easy for me. If I came to the answer like I was like, me think, like occipital. Like I knew it, but it took me a second to get there. Then you say good. If you got the answer right, but you weren't confident about it, like you're like, let me think, like it could be an occipital bone, maybe it's the parietal, like I'm not really sure, but I think it's the occipital, then you say hard. And then if you got it flat out wrong, then you say fail. And then it like, you know, keeps track of like how you're doing on certain cards, and then you'll complete that like set of 6 or whatever it gives you. It's a small number, and then you'll be like, okay, continue after that, and then it will give you the same ones again, especially if you struggled with them, but then it'll add in some, and then it'll keep on, like you'll keep going through cycles where you'll be like adding in new ones, and then like if you keep getting like easy multiple times on one, then it'll like stop giving you them, and you just keep going like that. And so I think that's a lot better for your memory than just starting with card 1, going through card 65, and then going back to the beginning. It's like, oh, I can't remember because I got it wrong the first time I did it, and now I haven't seen it in like 70 cards, and so I forgot. So like it keeps giving it to you until you really know it, and then you move on, but then it'll give it to you again later and see if you still remember it, and if you still do, then it'll put it off a while, and then like it's just got a really good algorithm that I like, and also it's free for pictures, so recommended. So my last exam that I did this for, we just had an exam on nerves and veins and arteries. So I have that on here. I'll click review, and then so where I get these pictures from, another reason why I like the iPad. So this is a picture from one of my lectures, and what I do is I take my pen on my iPad in the color white, and like see where these words are, I would take my pen with white and like color them out so then you can't see it anymore, and then I'll star them with different colors, and then I will write like orange star, and then I'll use the same picture for pink star, yellow star, red star, green star, and I'll do this with all the pictures in her slides. And so like, what is it? So orange star, I'm pretty sure that's the pterygoid plexus of veins. That's what I think the answer is. Flip, pterygoid plexus of veins. And then I would say easy, and then it would move on. So I really love this. I shared this with some people in my program, and they thought my Anki deck, because you can share your Anki deck with people like you do with Quizlet, and they thought it was super helpful for them to learn the structures. Highly recommend it. I was able to learn them like this. When I made that handball video about what I do outside of school, we drove 5 hours-ish to Portland. That's where we're from, and that's where our tournament was. And I had made my Anki deck in advance. That was for cranial bones, and this is what I did in the car. I took some nausea medicine because I get car sick, and pounded this out there and back. So that's 10 hours I was in the car, and I didn't want to waste it. I was like, listen, I want to do this tournament. I don't want to miss out on things in life just because I'm in school. Like, for me, it's important that I still do things that are fun, even though I'm in this hard program. So I'm like, I'm going to make use of my car time, make this Anki deck in advance, and do that on the way there and back. And then at the tournament, I was also studying for another class that I had a quiz on, I'm pretty sure Pharmacology. So yeah, I still do things, but I study around them. So this is a great way to do that. So that's what I do for my head and neck exams, which if you're taking your prereqs right now, like you're in anatomy, use it for anatomy. For the skull, I recommend still like looking at the skulls and making sure you can identify them on the skulls, because it can be a little harder to translate from like 2D surface to 3D with the skulls, I find. But I started with this and then went to the school, rented a skull, and like went through them, and I was like, yeah, that's where that is, that's where that is, after I had learned it through my Anki deck. And then last is good old Pharmacology, which I'm sure most people are curious about. I did really well in my last exam, and it's a very hard class. So what I do for Pharmacology is read through my lectures slowly. Like, I This one is a challenging class just because there's so many different categories of drugs. Like you have your antidepressants, and then within antidepressants you have like SSRIs, NRIs, blah, blah, blah. And then within your categories you have, you know, your different kind of medications. And then you have to know exactly what each one does. It's just a lot of things. A lot of them sound similar. You can get them confused. It's just challenging. So I start with reading through the lectures slowly. I'm like, okay, Cymbalta, that's an antidepressant. Specifically, it's in the SNRI category, I think. This is all memory. I'm not sure. I think it's an SNRI. And so I just kind of, like, I'm like, okay, SNRI, that's a serotonin norepinephrine reuptake inhibitor. Antidepressant, like, it's also has off-label use for neuropathic pain. Like, I just read through it like that. And I'm like, okay, got it, move on. And then for this class, I usually do make a Quizlet. Like I said, terms and also questions, like what's an off-label use for Cymbalta, for example. Things like that. And then I'll have Cymbalta and say like what it is, like what category, what it does, all the things about it, but then I'll have questions. But I don't like to go to Quizlet first. Like for me, I know there's like a learn feature. I do use it sometimes, but I also use it after I have tried to learn it already. For me, that's not where I like to go when I'm at like ground zero. Like when I know nothing, to me Quizlet isn't that helpful. It's more of like to make sure I know things, like a checking myself where I'm at kind of a thing versus learning it. Versus with Anki, like that's a great way for me to learn the structures like completely from scratch. But for me, Quizlet is like after I feel like I've got a general grasp on the thing I'm learning, then I like to use Quizlet. Personally, he does give us practice tests, so like same kind of thing that I do with the like practice or like the study guides that I showed you. I do the same thing with those. I fill them out and I talk them out. Sometimes I'll have my husband like read me the questions, especially because there's like short answer questions, so I'll like write them all on the thing for him so he knows the answers, and then he'll give me like the short answer question, and then I'll like say it out loud to the best of my ability, try to make sure I know all the information, and then if I miss anything, he'll be like, yes, good, but you missed this part, and then, you know, I'll like keep practicing like that. And then what I did differently between my first and my second exam, so we have 2 regular exams, like 2 midterms, they're both cumulative, and then we have our final. So our first midterm, I got an 80% on it, which is fine, considering how hard of a class that this is. And then for my second one, I got a 96%. That's like an extreme improvement considering the second exam had double the material because it had all the material from exam 1 plus all the material since exam 1. So what I did differently between those 2 exams was old school, I used to do this and kind of stopped because I felt like it wasn't that useful for me, but for this class it was. So I wrote out, I don't want to say everything, I didn't write every single word they had on every single slide, but I wrote out, okay, antidepressants, okay, categories like SNRIs, SSRIs, like every single thing, all the ones in those categories. It was great for me to just like be able to look at everything for like a kind of overview and see what's each category. I also color coded them, so each topic was like a different color. So my antidepressants were blue, like everything, all those notes were in blue with like blue and black. I used black for everything, but then like had a different color as well. So like blue and black for antidepressants, and then Parkinson's disease medications, those were all green, and so on and so forth. And so when I'm like taking my test and he goes, name me an SSRI, and so I'm sitting there like before I did this, I'm like, oh my gosh, I learned all these medications, you know, all these things, they all start to blend together, but I can think and go like, okay, those were blue notes. Okay, what ones did I write in blue? Like, to me, that's very helpful. Color coordinating can really improve your memory, and I think that was a big reason why I went from an 80 to a 96%. Also for this, I did a study group. It wasn't a very long study group. Well, it was maybe like 2 hours, but it was very helpful. I don't think study groups are helpful when you're learning the material, like from zero, but once you've learned it all you can, it's a great way to test your knowledge. So we went in there with our practice tests, and I'd be like, okay, to my friend Brittany, I'd be like, Brittany, tell me about this, or what's the answer to this question? And then she would tell me and explain to her at best of her ability, and she would test me, And then if there was something I really understood, I could explain that to her, or if there's something she really understood that I didn't, she could explain it to me. And we just were talking back and forth a lot. And it was like when we left that library, we felt really good about it, and we both aced our tests. So for me, that's the best way to study pharmacology, is using all those different methods together for any class. I think just layers of different things and different ways to learn things is the best method. I know this was kind of a lot of information. I think everybody learns different, but this is just what works for me. And so I hope this was helpful to you. If you enjoyed this video, please give it a thumbs up. And thank you so much for this request for this video. If you have any other video ideas, please leave them in the comments. I really appreciate it. And subscribe if you like this video. And I will see you guys in my next one. Bye!